Before sunrise on a cold morning in Las Vegas, Nevada, federal agents prepared to dismantle what would become one of the most shocking institutional betrayals in American higher education. Dr. Eleanor Margaret Whitford, age 48, had spent years cultivating an image as a champion of student welfare. Behind that carefully constructed facade, investigators would uncover a sophisticated narcotics distribution network operating within the very institution meant to protect young lives. The alarming pattern emerges. Over 18 months, campus health services documented a disturbing trend. Emergency medical interventions for students between 18 and 20 years old surged by 420%. The common denominator was a dangerous synthetic substance known as pink cocaine. Young people were found unconscious in residential halls, lecture rooms, and campus walkways. Several came dangerously close to fatal overdoses. What troubled federal investigators even more was the ease with which this substance penetrated campus barriers. Parcels ordered through encrypted online marketplaces arrived regularly at dormitory mail centers, student residences, and administrative buildings. Every shipment bore identical digital tracking signatures linked to a violent faction within the Sinaloa organization. When FBI analysts examined hundreds of transaction records, every path converged on a single destination: the administrative headquarters of Nevada University and the influential woman who controlled them. What appeared to be reckless student behavior was actually something far more sinister: a cartel-engineered distribution system operating openly within an institution families considered secure. The more investigators probed, the more disturbing the reality became. The investigation deepens. As federal teams intensified their scrutiny, the situation at Nevada University transformed from scattered incidents into evidence of a coordinated criminal enterprise. For 9 months, specialists from the FBI, DEA, and Department of Homeland Security analyzed electronic payment trails, examined campus surveillance footage, and monitored encrypted communications associated with pink cocaine shipments. The evidence proved undeniable. Dr. Eleanor Margaret Whitford had not merely overlooked a developing drug crisis. She had engineered a comprehensive system to facilitate product movement. Investigators determined she had enlisted 34 students as on-campus distributors. These first-year and second-year students, along with work-study participants, believed they were contributing to a legitimate health distribution initiative. That terminology, promoted directly by Whitford's administrative office, served as nothing more than camouflage. In truth, these students received payment to transport small quantities of pink cocaine through residence halls, student housing complexes, and first-year apartment buildings. Their activities blended seamlessly into daily campus routines, raising no suspicion. But Whitford had not constructed this operation alone. 5 veteran administrators, individuals who had served the university for years, were discovered manipulating delivery records, removing suspicious entries from mailroom databases, and redirecting packages away from security protocols. Their complicity enabled the operation to expand without triggering institutional safeguards. The financial dimensions proved even more staggering. More than $28.7 million in cartel proceeds had been channeled through the university's Innovation Funding Initiative, disguised as academic scholarships, research grants, wellness programs, and campus enhancement donations. Documentation appeared entirely legitimate. In reality, these funds represented laundered money for a Sinaloa subsidiary connected to the Chapitos faction. By the time investigators completed their analysis, one conclusion dominated all others. Pink cocaine wasn't spreading through chance. It was being systematically delivered, coordinated, and shielded from within the university itself, a criminal apparatus masquerading as an educational institution. The tactical operation. At 4:42 a.m., inside a federal operations center in San Bernardino, a digital display of Las Vegas illuminated 12 red coordinates. Each marker identified a location connected to Dr. Eleanor Margaret Whitford's clandestine network. her administrative suite, 3 off-campus research facilities, 2 storage warehouses registered under her spouse's identity, and 6 apartments suspected of serving as distribution hubs. The atmosphere in the command center was focused and deliberate. Agents had invested months preparing for this decisive moment. Within seconds, coordinated teams from the FBI, DEA, and Homeland Security initiated simultaneous operations. Just before dawn, unmarked federal vehicles approached the 9th floor of the administrative tower at Nevada University. Students remained largely asleep, unaware of the enforcement action unfolding above them. FBI tactical specialists breached Whitford's office door with a single powerful strike. Inside a hidden wall compartment, they recovered exactly what intelligence had predicted: 3 kilograms of pink cocaine, a high-powered firearm, and $1.2 million in cash arranged in neat stacks. When Whitford arrived via elevator moments later, she stood motionless. Students heading to early morning classes witnessed the woman they had admired, the administrator who had spoken passionately about student health, being handcuffed and escorted away. Some observers stared in disbelief, others whispered among themselves, and several simply remained frozen, unable to process what they were witnessing. While Whitford was being detained, a separate team executed a warrant at a Henderson warehouse officially registered as a youth research laboratory. Inside, agents discovered something entirely different: large industrial containers concealing 67 pounds of pink cocaine and 22 pounds of fentanyl. As the team advanced deeper into the facility, 3 cartel operatives attempted escape through a side exit. One individual brandished a weapon. The space erupted with the sharp report of gunfire. Agents responded with measured, controlled fire. A flashbang device detonated across the concrete surface, producing a blinding burst of light. 2 suspects immediately surrendered. The third capitulated moments later, disoriented and trembling. In Paradise, a second facility devolved into a 4-minute armed confrontation within a confined corridor. Agents advanced methodically until all suspects were disarmed. In North Las Vegas, a storage facility yielded 14 containers of encrypted financial documentation, records that would ultimately expose the complete money laundering infrastructure. By 6:10 a.m., the coordinated operation concluded. 23 suspects apprehended, dozens of packages secured, 3 active distribution centers eliminated. But for investigators, this represented merely the opening chapter. Unraveling the financial web. When the tactical operations concluded and suspects were transported to federal detention, the analytical work intensified. The seizures from Henderson, Paradise, North Las Vegas, and the university administrative offices revealed only the framework of the operation. The underlying details, organizational structure, financial flows, and inner circle connections remained buried within hard drives, email servers, campus databases, and financial ledgers. Inside the Las Vegas Federal Analysis Center, dozens of specialists worked continuously through early morning hours. Photographs of seized evidence covered the walls: currency bundles, routing codes, shipping labels, and carefully concealed drug packages disguised as health supplies. Every file underwent cataloging, every device was forensically cloned, and every text message and encrypted account received line-by-line examination. The initial breakthrough emerged from the university's own financial infrastructure. For years, Nevada University had promoted its Innovation Funding Initiative as a program supporting student research and campus improvements. Under federal scrutiny, however, the numbers revealed a vastly different narrative. More than $28.7 million had been processed through this fund from external donors who simply did not exist. These donations were actually transfers from a Sinaloa faction tied to the Chapitos organization. On official records, these payments appeared as scholarships, wellness grants, and facility improvements. In reality, they constituted drug money being laundered through an academic institution on a scale previously unimaginable. Even more troubling were partnerships that initially seemed innocuous. Two non-profit organizations, both ostensibly promoting mental health awareness, had received substantial donations from identical shell companies funding the university initiative. These nonprofits maintained no physical office space, employed no documented staff, and operated no verifiable programs. Their sole function was converting cartel proceeds into legitimate-appearing funds. Then came the off-campus properties. 3 research centers and 2 storage buildings were all registered under the name of Whitford's husband, Mayor Thomas Vega. Municipal planning documents revealed that several approvals had circumvented standard review procedures. Some authorization forms bore signatures directly from the mayor's office itself. By the time investigators completed mapping these connections, the truth became unmistakable. This network was not assembled hastily. It was not accidental, exploiting loopholes, or dependent on a few rogue individuals. It was a deliberate system, layered, protected, and concealed behind institutions the public trusted. The institutional cleanup. As federal agents processed evidence collected across Las Vegas, one reality crystallized. The tactical raids represented only the initial phase. Interrupting drug distribution was critical, but identifying and removing the enablers who sustained the system proved equally essential. By mid-morning, teams from the FBI and DHS entered the administrative sections of Nevada University. These were not the dramatic entries witnessed during Dong operations. No forced entries, no tactical devices, merely agents proceeding calmly through corridors lined with achievement plaques and inspirational displays. 5 senior administrators, the same individuals who had helped erase shipping records and manipulate mailroom documentation, were quietly escorted from their offices. Each had worked alongside Whitford for years. Each had authorized documents that made illegal shipments appear routine. Their workspaces contained travel forms, student files, reminder notes, and in several instances, envelopes of currency concealed behind furniture. Meanwhile, dozens of students who had unknowingly served as couriers underwent interviews. Many sat across from agents with unsteady voices. They had believed they were participating in a legitimate health outreach program. They assumed their deliveries contained harmless supplements or medical supplies. None understood they were transporting cartel product. Several broke down emotionally when confronted with evidence. The consequences extended beyond the university. Municipal investigators entered government offices linked to Mayor Thomas Vega. Filing systems were opened, contracts pulled, storage permits and zoning authorizations examined methodically. The pattern aligned with what federal agents already understood. Vega had quietly approved facilities and research centers that actually served as fronts for cartel operations. By early afternoon, 3 municipal employees were suspended. 9 university administrative officers were removed from positions. The Innovation Funding Initiative was frozen. 2 nonprofit organizations were ordered to cease operations pending comprehensive audits. The lasting impact. When evening descended over Las Vegas that day, the enforcement operations had concluded. Administrative offices were secured and suspects remained in custody. Yet the sense of accomplishment was restrained. Federal agents recognized they had eliminated the operational leadership. What remained was something far more profound, the impact of what Dr. Eleanor Margaret Whitford's network had inflicted upon a generation of young Americans. The investigation revealed the operation had functioned for 18 months. During that period, more than 11,000 students across 4 counties had passed through dormitories, classrooms, and student housing affected in some capacity by the network. Not every student used pink cocaine, but many had encountered couriers, shared spaces with them, or resided in buildings where shipments were quietly distributed. The institutional environment had been compromised long before anyone recognized the danger. Agents now confronted the second phase, determining how extensively the system had penetrated beyond the primary campus. The lesson for America. The deepest lesson transcends narcotics. Institutions remain secure only when communities maintain vigilance, when people ask difficult questions, when students speak honestly, when parents demand transparency, when society stops assuming that credentials guarantee integrity. Stories like this expose more than cartel networks. They reveal how fragile trust becomes, how easily corruption penetrates when oversight weakens, and how critical it remains for citizens, especially parents, especially voters, to maintain awareness. Dr. Eleanor Margaret Whitford didn't simply fail her institution, she weaponized it. She transformed educational spaces into supply corridors. She converted students into unwitting distributors. She turned wellness programs into money laundering fronts. And she accomplished this while maintaining public appearances and engaging with parents who believed she was protecting their children. The investigation continues. Las Vegas witnessed only the initial exposure. Until every remaining connection in Whitford's network is identified, federal investigators will proceed quietly, persistently, and without compromise. Because the challenge ahead extends beyond narcotics, it concerns reclaiming institutional trust, one organization at a time.